Good morning, all of you. This is Dr. Vedavati K, pediatrician. Today we'll talk about urinary tract infection. So first of all, what is urinary tract infection? So urinary tract infection is like infection somewhere in the tract from the kidney to the urethral opening. So it could be kidney, it could be ureter, it could be bladder, it could be urethra as well. So in this tract, anywhere there is infection, it's called as urinary tract infection. So we will see what are the symptoms of urinary tract infection. It could be like increased frequency of urination, burning maturation, pain during maturation, or the child might have frequent urination, or the child will start having recent bedwetting, or there is abdominal pain, or like fever, vomiting in severe cases. Then overall at the risk of urinary tract infection, it's like girls are more affected than the boys because the distance of urethra is very short, and the distance between the urethral opening and the anus is also very short, so the chances of infection from the fecus to the urethra is very high. And boys who are less than 1 year of age, who are not got circumcision, they are also at the higher risk of getting urinary tract infection. So other than this, if there is any kidney abnormality, urethral abnormality, ureteral abnormality, bladder abnormality, so they are also at the higher risk of having urinary tract infection. So what are the most common causes of urinary tract infection? Is like bacteria, and there are different types of bacteria depending on the illness. Coming to the management of urinary tract infection, it's very simple. First, we need to give urine for testing to confirm whether we have urinary tract infection, like urine routine, and culture is for the antibiotic sensitivity and the pattern of the bacterial sensitivity we need to check. These are the simple investigations. But in case the child is very sick or less than 6 months, in those cases some blood investigations and ultrasound will be told in the initial visit. And if the infection is like less severe, we will treat with oral antibiotics and oral liquids and some symptomatic medicines. If the infection severity is very high, we need to give IV antibiotics and IV fluids and other things. Then a few cases, if it is like when kidney abnormalities or severe kidney disease is suspected, they might ask you for a special test. And why we should treat urinary tract infection, or why it's important to do timely diagnosis and treatment, is like if there is frequent or poorly treated, undertreated UTIs can lead to kidney scarring, and then subsequently poor kidney functions, which will lead on to slowly to kidney failure in the later stages of life, or decreased kidney functions, which will end up in dialysis and other things. So in order to avoid all those things, we need to pick up the urinary tract infection in time and treat them adequately. Thank you.